Okay, today on the Femme FC podcast, I'm so happy to have Emma Brockwell. Emma is the pelvic health physiotherapist for many of the Women's Football Super League clubs, including Chelsea Women's Football Club, Arsenal Women's Football Club, Manchester City Women's Football Club, and Aston Villa. Alongside this, she works and consults for the Netball Players Association, consulting with the Netball Super League. Besides a passion for working clinically, she's a female health consultant for FIFA, working on many pelvic health research projects and supporting the development of FIFA female health education. Emma, it's so great to have you. Thanks so much for joining us.
Oh, I'm so excited to be talking to you. I remember when we were talking at the Isokinetic conference about this amazing project that you had lined up, and now it's coming to life. It's exciting to be a small part of it. So thanks for having me.
Of course. So, can you just tell me and the rest of the listeners a little bit about your background and how you came to specialize in pelvic health, specifically in elite women's soccer?
Yeah, so it wasn't a typical introduction into elite sport that perhaps some of your listeners may have found with their own careers. I started as a physio many years ago. I won't share how many years ago because then you'll know how old I am. But it was a long time ago, and I was a musculoskeletal physiotherapist for about 7 years, and then started to explore the world of what was then called women's health and is now pelvic health. And really, that passion grew once I had children and actually, as a keen runner, experienced pelvic floor symptoms after having my children and was very aware of the lack of support, research that would help guide women back to the sport that they loved. And so I don't know, I just saw the gap and thought, well, this is crazy. Why has no one done something about this sooner? And started to really explore more of the sports related conditions that can occur with the pelvic floor. And really, my foray into football, soccer, occurred because I started to work with a pregnant soccer player at Chelsea, and I guess she did a really good job of promoting the benefits of pelvic health physiotherapy. And beyond that, this was at Chelsea, obviously. Emma Hayes was managing at the time, and she is so passionate about all female health considerations, and really took it upon herself to entertain the idea of having me in more often, screening and educating players, and recognizing that really pelvic floor symptoms don't just affect pregnant and postpartum women, they can affect any girl or any woman. So I guess Emma really gave me the leg up into the world of soccer. And as you know, over the past few years, that interest thankfully has grown, and I'm here now, hugely grateful, hugely lucky, and hugely loving what is really the beginning of pelvic health into the elite sports world.
Yeah, absolutely. And so you work across a number of different clubs, and my understanding is they bring you in as a consultant. And I actually got a chance to speak with Gary Lewin from Arsenal when I was writing my master's dissertation about sort of like how the organizational structure is set up and how he brings people in. So I have a pretty good understanding of like kind of how he uses you and people like you at Arsenal. But could you talk a little bit about what your role looks like and what the work looks like in like across different clubs, if the role slightly varies depending on the environment, the resources, culture, etc.?
Yeah, it definitely varies across each and every club that I work at. There isn't a set look as to what I offer. I would say that within most of the clubs, I go in as an independent consultant, screening, educating staff and players about pelvic health, and then offering treatment to those players who wish to take me up on being seen. And that is very much me driving that, but collaborating and integrating into the whole interdisciplinary team in each and every club. Arsenal's a little bit more unique, I would say, because I am very much taking on and still doing that role, but I'm also mentoring one of the MSK physios at Arsenal, Emma Saunders, who's just amazing, and she has a real interest in all things female health, but in pelvic health in particular. And so I'm mentoring her, and we're developing the female health service there. So it's really exciting. It's exciting in each and every club, but I guess at Arsenal, having that mentorship role is pretty special and unique. And yeah, I really enjoy it. It's amazing.
I want to ask you a little bit about that, if that's okay, the mentorship part. What do you find are some of the gaps in physios or other therapists who go in and, maybe have an MSK background, sports background, but go in and start working with elite women's footballers? What are the gaps that and I will include myself in this, don't really have that knowledge on pelvic floor, and what are some of the things that they really need to focus on trying to upskill themselves in?
I think it's a gap, not just amongst physiotherapists. I think it's strength and conditioning coaches, doctors. It's everyone. We certainly, when I trained as a physio, okay, I'll let on 20 years ago, I was definitely not told much about the pelvic floor, about pelvic health. I think I maybe had a short lecture on it, but nothing that really changed my views on the pelvic floor, or had an opportunity to see how we integrated it into the sports medicine world. And I definitely think that there's still that gap. If you look at research papers, if you go into universities, pelvic health isn't really being included within sports medicine. And as a result of that, when you then go into any environment, including elite sport, why are you going to think about it if you've not actually been told about it? And it's bonkers, really, because if you look at pictures, illustrations of the pelvis, the pelvic floor is omitted, which is kind of strange given that each and every human has got a pelvic floor, and yet we don't think about how that might impact not just our pelvic health but our musculoskeletal health as well. So it's no one's fault, but we're recognizing that this is an issue now, so we therefore have to do more, and we have to educate everyone so that all male and all females pelvic health is considered within the general population, but also amongst athletes as well.
Yeah, absolutely. I know for sure there are gaps in what I learned in school versus then going out into the clinic, and especially as a practitioner who then goes in and starts working for a women's club, you don't get a lot of reps of anything, and so everything you see is, of course there's the common injuries in soccer and football, but when you're only working with a total of maybe 30 people over the course of a year, you're not going to see high reps of anything, let alone something like pelvic floor. So having someone like you be able to come in and mentor, I think, is such a benefit for the practitioner, and then also ultimately for the athletes.
Yeah, totally. We're just giving it that 360 holistic approach that we should be giving to every woman's health, whether or not, whether they're an athlete or not. And I think it's difficult because it's knowing the right questions to ask. It's difficult to have that conversation. We'll probably talk more about why that might be in a moment. But, once you start having the conversation around pelvic health, it soon gets easy. It soon becomes a more normal part of conversation in the female health and athlete space. But it's about having that conversation and not just hoping that it goes away, because it's not going anywhere. It's essential that we're having it. So getting comfortable with it is really, really important. And I think that's where I can help, certainly with that mentorship, giving someone the confidence to ask sometimes slightly awkward questions that soon become normal the more and more you ask.
So on that note, if there's a strength and conditioning coach, a sport physio, a sport scientist, whomever, working with female footballers, what are some things that might clue them in that, hey, there might be something going on with the pelvic floor here? This may be something that I need some external help with. What are some, like, either things that athletes will say or symptoms that they'll come across that might clue them into that?
Yeah, so behaviours might be giving certain things away. So if you see your athlete constantly going to the toilet, particularly just before training or before a game, or even if you see them avoiding certain movements, often plyometric movements, then that might be a sign that perhaps they're, avoiding them because of something that's occurring, which might most commonly be urinary. No one wants to experience that. So by avoiding the higher impact work, they are less likely to experience that symptom. So recognizing those behaviors, noticing if they're avoiding hydrating. There's a myth that the less you drink, the less you'll leak urine, but I can assure you that's sadly not the case. But it makes sense, doesn't it? If I don't drink as much, I'm not going to wet myself. Doesn't quite work that way, but that's certainly something that clinicians or coaches might pick up. Beyond that, athletes might actually say to them, "Oh, every time I do this, I wet myself," and they might laugh it off as a slightly awkward comment or statement, but that's not normal. It's really common to experience that, but it's not normal. And so that's gold. If you hear an athlete tell you that, then you can absolutely do something with that and signpost them to someone like myself. Also, if you've got players who have got long-standing hip pain or low back pain or coccyx pain, that might be a sign that the pelvic floor is involved. It might not be the cause, but it might be that if we shine a pelvic health lens on that symptom, that we can help improve that symptom, particularly if it's long-standing. So there's lots of giveaways. It's just being tuned into those little signs that they might be offering you without even knowing it themselves. And if you recognize that, it can just be such a game changer for anyone experiencing those symptoms. It really can.
And so you mentioned athletes who maybe avoid hydrating or plyometrics or anything, or are going to the bathroom frequently. Do you find it to be kind of like urine leakage issues? That's one of the primary things that you're seeing in this population. Urinary incontinence, or what are some of the most common things that you're seeing?
Yeah, exactly right. Urinary incontinence is the most common symptom that I see, alongside frequency of urination as well. So I see a lot of players who will be going to the toilet every hour, every half an hour to have a pee. And for the majority of the population, that is too much. Typically, we would expect someone who's drinking high volumes of fluid to perhaps be peeing every 2, maybe every 3 hours. If you're not drinking as much, maybe every 3 to 4 hours. But every half an hour to an hour is too much, and therefore we recognise that the bladder or the pelvic floor might not be optimally working, and then obviously we can hopefully do something about that. So they're the two most common symptoms I would suggest that we see. But they're also probably the two most normalised symptoms that players are more comfortable discussing, bizarrely. So they don't often recognise the other symptoms, even constipation, or fecal urgency or fecal incontinence, which is very unusual in this population, but it can occur. And so we need to be aware that we're not just talking bladder, we're talking bowel as well, that can impact players as well. But the most common, urinary leakage for sure.
And so let's say I'm a physio working, or an athletic trainer here in the US working in a pro women's football club, and I don't have the resources to have somebody such as yourself on the team, or even as a consultant. What could be my first step in trying to get to the cause of this issue, or some of the root causes that might be contributing to this athlete's symptoms? Where can my assessment go? What are some things that me, as somebody who's a sports physio but not trained in pelvic floor in any special way, what can I do about this?
Yeah, so the first thing for sure is education. So highlighting to all the players that these symptoms that we've discussed are really, really, really common. And they're probably impacting around 1 in 2, 1 in 3 soccer players, female soccer players. So don't be surprised if they report those symptoms, and discussing with them why they might be occurring. So getting educated yourself, but sharing that education with players is key. Then help them manage it, first of all, because obviously we want to treat and resolve the symptoms, but we need to help them manage the symptoms so that they're not avoiding doing certain things or feeling highly embarrassed because they're wetting their kit. So thinking about pads or incontinence underwear, there's some really good incontinence underwear now, and suggesting that they use that so that they feel more comfortable, because it can really negatively impact any woman's confidence or mental health. So we want to make sure that from that side of things, they're able to manage their symptoms a little better. And then I would definitely recommend thinking about, of course, their pelvic floor strength, but we do demonize or hone in a little bit too much on a weak pelvic floor. And typically in this population of women, it's often not because the pelvic floor is weak. It's often that the pelvic floor perhaps can't manage the pressure that's being put upon it, or there's a poor ability to coordinate the reaction times of the pelvic floor. So the pelvic floor is an anticipatory muscle, and we've got some really good research that shows in running, just before you heel strike, the pelvic floor will contract. And in some women that doesn't happen for a variety of reasons. So it could be that the coordination is off. The pelvic floor is a trampoline, ultimately, or it should be working like a trampoline to absorb the ground forces and the intra-abdominal pressures that are put upon it and within it. And a lot of athletes, their trampoline isn't nice and bouncy. It's almost like a bit of a brick wall. There's too much tension within that pelvic floor. And that might be because the pelvic floor is compensating, or because the athlete can't manage pressure. So ensuring that if you're going to teach pelvic floor exercises, you're teaching them in a functional position. They stand when they play, so we should ideally treat them in the standing position, but ensuring that we're not just talking about the squeeze of the front and the back passage, we're also talking about the release. And in my opinion, with athletes, we need to focus more on the release than we do on the squeeze. It's very rare to find an athlete with a weak pelvic floor, ultimately. Beyond that, we want to think about the other muscles that work alongside the pelvic floor. So if you think of all the bony attachments as to where the pelvic floor sits in the pelvis, it's very closely linked to our adductors, our hamstrings, our glutes, abdominal muscles, and actually the pelvic wall that integrates into the pelvic floor is formed by the piriformis and obturator internus muscles. So there has been some research, albeit in the older population, that's shown that just by addressing glute strength, that will help pelvic floor symptoms of urinary incontinence. So it might just be that you look at how good they are at activating their glutes, or is their posterior chain just not activating as effectively? Are they holding their breath when they pogo, and therefore they can't manage the pressures or coordinate the pelvic floor? And if you just taught them to breathe whilst they're pogo jumping, you might actually find that they don't leak as much. Or even looking at their posture. Can you reduce rib flare? And by reducing rib flare, does that help the pelvic floor and diaphragm integrate more effectively and allow that trampoline to move a little bit more effectively? Or could you just modify the activity that causes the symptom, for example, a pogo, and perhaps get them using a band or TRX just to offload their system and just allow the pelvic floor time to coordinate, to get that neuromuscular control again. And by doing that, by offloading and just addressing that dose response and then building them back up to a higher level pogo, does that help reduce their symptom? So there's a lot to think about there. I haven't given you a really straightforward answer, but I think the message I'd love to get across is don't just think it's about a weak pelvic floor, because it's probably not in this population. And so we need to make sure we're thinking of it like any other muscle. Okay, it is like any other muscle in the body, and we need to progressively overload it again to help it rehabilitate and recover.
I love that you're highlighting that it's not weakness of the pelvic floor most often in this population. They're strong. And I love what you said about, they're standing for their sport, get them standing. I feel like anything I learned in school about pelvic floor was laying supine and having them do, like bird dogs, or in a quadruped, or have them do like a supine march or bridges, and then Kegel exercises. Like that was what they taught us. And so what you're saying, and correct me if I'm misunderstanding any of this. So let's say there's an athlete who is rehabbing something else, like let's say an ankle sprain, and we're working on plyometrics and you use pogos. And so we're doing some hopping. And same idea, where we wouldn't go straight into like single leg drop vertical jumps, or single leg like really quick or rapid plyometrics. We would start off with something like a regression of that, using a band, using some kind of assistance, or offloading it in some way. So let's say with that athlete, we're doing exactly that. We're progressing the amount of plyometric, and therefore that kind of trampoline function of the pelvic floor. Would there be anything within my normal interventions of progressing that I would want to consider or think about if this athlete is also having some urinary incontinence?
In what respect? So if they're experiencing urinary incontinence when they're hopping after an ankle injury. Sorry, Nicole, I didn't quite catch you on that question.
Sorry, no problem. Yeah, so if I'm rehabbing someone and I'm already going to be doing a progression of plyometrics, and let's say it's an athlete who also has some urinary incontinence, as I'm progressing their plyometrics, is there another cue I should give them, or something else that I should be considering in those interventions or in that progression that will help with the urinary incontinence? Like, I'm already doing a progression for the ankle, but is there something that I should cue them on to help with the urinary symptoms as well?
Gotcha, sorry. Yeah, so you want to think about that timing of the pelvic floor. So I'm not suggesting that this continues forever, but it might just be that if you get them to exhale and activate the pelvic floor just before they hop, does that help reduce their urinary leakage? Because you're offering them that opportunity just to address that timing issue that perhaps is causing the symptom. And by almost getting them to, if you like, it's called the knack, getting them to activate with or without an exhale, it can just help the brain say to the pelvic floor, okay, this is really when you need to activate. And therefore, if that helps reduce their symptoms, that's a good sign that by integrating that into the ankle plyometric work that you've given them, that will help reduce their symptoms whilst also rehabilitating their ankle. And then obviously, as that motor control improves, you won't have to continue to use that, because ultimately they can't be exhaling and squeezing their pelvic floor at the same time when they're out on the pitch. They need to have that anticipatory reflex returned by that point. But hopefully over a few weeks, by them just using that cue, that might just help resolve their symptoms, or start to resolve their symptoms as they're rehabilitating.
Great, I love that. And so we talked about urinary incontinence as being kind of like the primary thing that is seen. It's actually shocking to me how common it is. You said 1 in 2 to 1 in 3. I mean, it's surprising, but also not. Like, I know a lot of women who suffer that, who are runners or just gym goers. What are some other issues that maybe are less common that you've seen come up in this population as well?
Yeah, so I think, unfortunately, constipation is a big symptom that occurs within this population. And at times pelvic pain as well. I say at times I've seen a lot of players report coccyx pain. That is predominantly because the deeper pelvic floor musculature is less like that trampoline and more like that brick wall. It's got that overactivity, that hypertonicity that we see occurring in the pelvic floor, and that can then aggravate the coccyx because of how the pubococcygeus and the deeper pelvic floor muscles attach onto the coccyx. So I do see quite a lot of that, unfortunately, in players. Less likely to see signs and symptoms of pelvic organ prolapse in soccer players so far to date. Pelvic organ prolapse is where the front, the back, or the top of the vaginal canal becomes a bit floppy. And in some women, the vaginal canal can descend into the vaginal opening and create a bulging of the tissues, which can create heaviness in the vagina, but it can also create a real discomfort and, as I say, a bulge in that area, which typically, but not exclusively, is more likely to occur in the pregnant and postpartum population with weight of baby and pushing of baby during childbirth. So I'd say in this particular athlete population, we see that less likely. But the research has shown in female rugby players that pelvic organ prolapse is being seen, and I think potentially that's because the researchers are asking those questions, but also given the really high impact and really high contact that rugby players experience, we're more likely to see that unfortunately occur because obviously there's more going on in that sport compared to football.
And so that's a good point to bring up is postpartum athletes and pregnant athletes. This is something that just a couple of years ago, maybe there would be one in a league, right? And now it's becoming more and more common that female athletes are choosing to and are able to have the support to be able to not put having a family on hold and still do it during their athletic careers. At the same time, there's also now teenagers playing professionally. And so kind of the age range of a professional soccer player can be anything from a teenager to up to 40 and having a couple kids. So are there vast differences in some of the things you're seeing now as opposed to a couple years ago, and also across the spectrum of where they're at in their career and how old they are?
Yeah, I think it's interesting because funnily enough, we were screening Arsenal today, and I certainly see across the clubs that the players who are experiencing these symptoms, let's say of urinary leakage, that these symptoms haven't just occurred. They've been experiencing them since puberty, a lot of them. So for many of them, they've put up with them for 4, 5, 6, 7 years. I think the difference is they haven't been asked questions about it before. So now we're asking those questions and unpeeling the layers. We're actually seeing that, unfortunately, a lot of them are padding up and putting up with the symptoms, almost normalizing them, because they do discuss them, the symptoms, with other players, and typically those players will say, well, I have those symptoms, so it's probably just as a result of being an elite athlete, and it doesn't stop us playing and it doesn't hurt, so we kind of just have to put up with it. But now we're asking the questions, but ultimately having to deal with symptoms that have been there for quite some time. You're right in that we are seeing more and more players getting pregnant and also returning to sport postpartum, and that's super, super exciting. But that's really where pelvic health, I think, at this particular stage in the pelvic health journey, is really having its moment, because we do know that pelvic health is important for these women, even if they don't have symptoms. And I think that's something important to highlight. We are wanting to proactively prevent symptoms happening. we know that high impact sport is a risk factor for pelvic floor dysfunction. But then you add on pregnancy and postpartum, that's another risk factor. And then, of course, as we age and hormones shift and change and we go into the perimenopause, that's another risk factor for pelvic floor dysfunction. So really what we want to do is try and support and prevent symptoms happening at a young age, so that when a woman decides, if she chooses to get pregnant, then she's already integrating pelvic health into her training. So it's just another layer that she's used to, and she's then optimizing her pelvic health during her pregnancy and perhaps shining more of a light on it at that time, so that then when she has baby, not only is her postpartum return to sport, if she chooses that path, a lot easier and optimized, it also then future-proofs her pelvic health for when she enters the perimenopause. And so I don't know, we owe it to women to be offering this, given that we know that as they get older, this is a risk factor, and most of us are likely to experience these symptoms if we don't address our pelvic health now.
So in the pregnant and the postpartum athlete who does choose to return to sport, what are some of the things during their pregnancy, in the time, in their postpartum time, as they're training to get back to sport, what are some of the main priorities that they should be thinking about when it comes to their pelvic health?
Ideally, that they're not experiencing any symptoms at all. And as I say, really, I think we can make so many gains if we can start training pelvic floors, learning to contract, but also relax the pelvic floor during pregnancy. But alongside that, addressing the other musculature around the pelvis and the abdominal wall. Strength training is so important during pregnancy. And I think for too long now we have told women they shouldn't do too much exercise during their pregnancy. They should be super cautious, and oh my goodness, don't even think about keeping your athlete hat on when you're an athlete and you're pregnant, because that will only damage you and baby. Actually, we now know that the research clearly shows that you can train as an athlete during pregnancy, and the benefits it brings to you and your baby are massive. It reduces comorbidities like preeclampsia, gestational diabetes. We know that being active reduces those occurrences, but we also know that the more active you are during your pregnancy and the stronger you are internally and externally during your pregnancy, the more likely you are to return to sport, or just ready your body for being a mother, because being a mother is a heavy job. You're lifting baby, you're lifting equipment. So even if you choose not to go back to your sport, you need to have strength. And so we shouldn't be wrapping women up in cotton wool, and we shouldn't just be saying to women, because we don't know, no, don't do it. We have research now that says we need to be doing these things, and we need to be advocating for women, and also really sharing that research with the general population, but the athletic population as well, so that we can really optimize their pregnancy and postpartum return. And I think when we do that, we're seeing women return to their sport stronger and better than ever before. So it's super exciting, but we need to keep getting that message out there, because I feel that everyone knows it in my little social media bubble, but actually the truth of it is, my echo chamber is not really what the rest of the world's hearing. So we must promote that as healthcare and strength and conditioning coaches, for sure.
Yeah, absolutely. And so I hesitate to ask anyone ever about, specific interventions or exercises for XYZ, because it does always depend on the individual, and what's going on, and context and all of that. However, at the risk of all of that, are there any like kind of go-to interventions or exercises that are good for someone who wants to try to get ahead of having good pelvic health and keeping that healthy throughout their athletic careers?
You're right. There aren't any frameworks that currently exist for elite athletes during and after pregnancy, unfortunately, but we're working on that. And we have written a decision aid. So we've written a decision aid and a framework that FIFA has supported us in writing. So that team consists of myself, Margie Davenport, Sinead Dufour, and Evie Casagrande, and we're basically, the four of us have put together, I think, a really good decision aid that will help anyone working with athletes, but athletes as well, in understanding what exercise to focus on during and after pregnancy. That's not yet published. It's good to go, it's just not yet published. So, I mean, you know this better than I, it just takes time to get that information out there. But beyond that, we really do need to consider that an approach to pregnancy and postpartum rehabilitation ideally should be collaborative. It should be massively athlete-centered. So it has to be a shared decision approach with the interdisciplinary team and with the athlete themselves. So ask the athlete what they want to do during their pregnancy, and it's very rare, really, that we would say no to doing strength training, to keeping their aerobic capacity up. Even doing HIIT is possible during pregnancy now, and we've seen some really good research that backs that up. So there is a lot of research, and I would very much encourage you to look at the work by Margie Davenport and her team. I think on Instagram she's at Exercise and Pregnancy. She's written the Canadian pregnancy and postpartum guidelines that, yes, are for the general population, but are a good starting point. But really, if you are a soccer player, train like a soccer player. Yes, we don't want you to be doing high intensity contact. And that's not because of the reasons we used to say, it's just because we don't know enough to know that you and baby are safe. We've just recently published a paper that's actually shown that potentially low intensity contact is likely to be feasible during pregnancy, but we don't have substantial evidence to absolutely support that yet. But the evidence around contact is based on very little. So we need more research so that we can comfortably say, yes, as an athlete, you can or can't be doing contact. But beyond that, you can still kick the ball. You can still do certain football drills within your pregnancy. You can still lift, for sure. Christina Previtt's done some amazing research around lifting during pregnancy and shown that it doesn't have a negative impact on baby, on mum. In fact, it has nothing but benefits, and it doesn't have a negative impact on the pelvic floor. So using those resources just to really help empower you as an athlete or empower you as a practitioner is really helpful. But there will be more coming out. We just haven't got it just yet.
So when it does come out, I'll definitely make sure to put that out on socials and everywhere else so that we make sure we get that across to everyone. So switching gears slightly, if let's say there's, practitioners working in a club, and every preseason, we start with a preseason medical assessment or pre-competition medical assessment. A new player comes into the club, same thing, do a general medical intake. What are some key screening questions that we should be asking athletes when it comes to their pelvic health?
Well, this will come as no surprise, but we don't have yet a football-specific pelvic health screening tool, unfortunately, just yet. But until that happens, because it will happen, I would definitely recommend, particularly if you're not someone that's familiar with pelvic health, that you download the PFD Sentinel. And that is a 5-question screening tool that will give you a good idea as to whether or not the athlete is experiencing symptoms. So that asks whether the athlete is usually experiencing urinary leakage, urinary urgency, which is accompanied by frequent urination, and nighttime peeing. It asks if any of the players are experiencing a bulge in the vagina, if they're experiencing a loss of gas or or stool. And it also asks if they're experiencing pain or discomfort in the lower abdominal wall or genital region. And if they are ticking any of those boxes, then that is a good enough indication to suggest that they would ideally benefit from seeing a pelvic health physiotherapist, or for you, if you can, to shine a bit more of a pelvic health lens and perhaps try some of those things that we talked about earlier in helping reduce those symptoms. So the PFT Centre now is a really good place to start. And if you don't feel comfortable asking those questions to the player, you can print it off and you can just give it to them, and they can just go home and complete it in their own time and then give it back to you. And then perhaps that's an icebreaker to start conversation around their pelvic health.
Yeah, I like that idea in terms of giving practitioners and also athletes, because either one involved may be uncomfortable with answering questions or asking questions. So I like the idea of having something that is less kind of direct and in your face, not a face-to-face conversation. Are there any other tips of advice or I don't know, insights that you have into and I'll say if athletes are uncomfortable discussing it, because I think that as practitioners, we should see it as it's part of their health and part of their medical care. And just like with anything else, we shouldn't really be embarrassed to ask or talk about it. But what if athletes are uncomfortable with it? Do you have any go-to strategies for addressing that?
I think if athletes are uncomfortable discussing it, I do think writing it down is really helpful. I do think having that screening tool printed off. So there are some athletes who aren't comfortable talking about it with me, and so I will put the screening tool on an iPad and just give them the iPad and just say, right, just go and sit over there and just complete it. But know that these symptoms that I'm asking you about are really, really common, and then they're not something to be worried about, but there's something that we can help you with and help resolve, because you shouldn't have to put up with them if you don't want to. And so that seems to be quite a nice way of taking out that face-to-face contact, those questions. And actually, once they start looking at the questions, quite often they will come up to me and say, so I was experiencing those symptoms, what can I do about it? You can suggest to them, of course, that they just go and see their doctor and have that discussion, perhaps away from the club as well. Perhaps they don't want to talk about it with anyone within the club, and that's okay. But any GP or doctor should very much understand these symptoms. Yeah. Or the other thing I was going to say is you maybe say that they can talk to a teammate about it, and get the support of the teammate as well. Perhaps they want to do that through them, and have that conversation. I haven't seen that happen, I'll be honest, in the club environment I'm working in, and I think that's partly because what we'll always do before screening is educate. So we've already broken the ice with the education. They've all sat there giggling about the symptoms and looking really awkward and uncomfortable about what we're talking about. And so when we've broken that ice, I think that is quite a big game changer in terms of then how they feel about screening. A lot of them don't like talking about it, but as I say, we're into the second or third season in some of the clubs now, and now it really is quite, Emma, do you want me to fill out that pelvic health form about my pee and my poo? And it's just a normal conversation now that we're having. So hopefully by that, having that education, that can really break down some barriers for sure.
That's such a good point, and I think that's something that is so important for every practitioner in women's football, particularly. They're, on the whole, as a general rule, such a curious
Yes.
population to work with, and I think educating and explaining the why goes so far with them.
100%.
So I am so grateful for you coming on. Before I let you go, I do have two quick rapid fire questions for you. And they're less questions and more complete the sentence.
Mm-hmm.
So the first one is, I wish that every athlete, health, and performance practitioner in women's soccer knew this about pelvic floor health.
That pelvic floor health pelvic floor dysfunction is very common, but it's not normal, And most importantly, we can typically resolve most symptoms that occur. So if you're sharing that information with the athlete, that can be a huge game changer in terms of their physical, mental health, and potentially their performance as well.
Great. And the last one is, my favorite thing about working in women's football is?
Honestly, the camaraderie, the opportunity to work within an MDT. I've been a lone practitioner for quite some time, so it's just gold to be able to work with the staff and the players. Yeah, I love it. It's magic.
Thank you so much, Emma. If anyone listening wants to learn more about you, connect with you, I know you have a podcast, you have a book, a whole book that people can go and buy on Amazon and read. But where can people find you? And are there any other resources that you think would be helpful for people?
Yeah, for sure. So you can find me on Instagram at PhysioMumUK, or on LinkedIn. I'm Emma Brockwell. You can absolutely buy my book, which is really for the pregnant and postpartum population. It's called Why Did No One Tell Me? Beyond that, I would very much recommend certain resources, including the Active Pregnancy Foundation. If you're working with pregnant or postpartum athletes, that's full of really useful information and evidence-based research. So I'd very much signpost you to there. I'd very much signpost you to Margie Davenport exercise and pregnancy website and Instagram. And if you want to learn more about pelvic health, I would highly recommend Michelle Lyons, who's an amazing pelvic health educator. She does amazing work, and Christina Previtt, she's doing some amazing work in Canada as well. And of course, you can also do a little module that I put together for the Better Clinicians Project, which is Adam Meakin's project that he runs with Ben McCormack. So yeah, there's so much. It's almost overwhelm, but hopefully those resources will help most who are working with female athletes.
Well, I will link all of those in the show notes. And Emma, thank you again so much. This was so helpful, insightful, and it's just always so lovely to chat with you.
Yeah, thank you so much for having me.